Good morning, everybody. This is Kanoa and Louie with RosaritoLiving.com, and we're in Rosarito Beach. And this morning we have Dr. Manuel Ceja with us. Thank you very much, Doctor, for meeting with us this morning.
Thank you, Kanoa. Thanks for this call, and let's see what can we share.
Doctor, you're one of my favorite Rosarito Beach doctors, and I really appreciate your time this morning. I want to let everybody know, we're going to have some tough questions to be able to ask. But what crazy times we're living in, Doctor. I never would have expected that we would be even having conversations like we're going to have this morning.
Yeah, but I think we're ready to talk about it, so let's do it. Yeah.
Okay. Yeah, I agree. We're going to have about a half hour to talk, and hopefully we can get to some questions. And just so for people know, this is really meant to help the foreign community here in Rosarito Beach, the English-speaking community, the people that maybe haven't lived in Mexico or in Rosarito and that maybe need some advice on what to do. We know that there's a lot of information out there right now for the Mexican citizens, at least online, for what to do. But maybe if you're not a Mexican or you don't know where to go and you're looking to what happens in case something happens, we're hoping to be able to give some guidance in order for people to be prepared.
Yeah, we have received your questions, the people is asking through your website, and I have some other information that I would like to share for Americans living here down in Baja, especially the Rosarito area. Yeah, sure.
Okay. Just really quick, I want to let everyone know that your business is located at the La Jolla development, La Jolla Real in front, and the business name is Kinesis. And so in the future, hopefully when everything opens up again, people can, if they want to come by and say hi to you, they can come over there and say hi.
Yeah, I was thinking on the telehealth, telemedicine, phone consultations, because I have time now. So I was thinking to start receiving phone calls and try to help people and, give them kind of directions to what to do. And probably I can recommend them something, and they can go to the pharmacy and get it and buy it. We have a lot of stuff that we can get over the counter, and sure. So I set up as quick as possible.
I think that it was one of the questions I had on there, the telehealth. I think it's the future, Doctor. And I think that what a great way, especially for people to be able to get a hold of you. And I didn't know if, maybe we can talk about that more about getting that set up. And so people can contact you and they can go over the symptoms. They can tell you what's happening without them having to come in, and you can give them advice or diagnose them over the telephone.
Yeah,
right?
Sure.
So we can talk more about that as we figure that out. And if you do get that set up, I'll do my best to help get that promoted. Doctor, the first question I wanted to ask you, and I'm going to start off with a hard question. And one of the questions is actually, if you ended up getting sick at your house right now, what are the instructions for your wife? What would she do?
Yeah. It's the first thing is how would you know that you're sick? Any kind of infectious disease has to show up by producing some sort of amount of symptoms. The basic like flu-like or cold-like symptoms are considered, that you are sick. So if you're sick, the first recommendation is to stay at home. That's the first thing. And if you get worse and you cannot handle it through the normal symptomatic medicine, like antihistaminics, then it's better to go to the hospital. And for American community, it's just they need to get across. And find to be tested at the States and receive treatment up there.
Okay, so I'm gonna press you a little bit on this, because I was in a situation with my wife, and I was going, all of a sudden she's thinking maybe I'm sick, and I was thinking, wow, okay, well, if she gets sick right now, what do I do with her? Really, actually, who do I call? What would I do if I've got a sick person there next to me right now? How do I handle that?
Yeah, if you don't feel sick, you're probably not sick. But, there are many asymptomatic cases that can still spread the virus. So that's why it's so important, the social distancing. So, because we might probably not know that we have it. So that's the recommendation. stay at home. Let's just stay at home, because that's for self-protection, but also to protect others. So this time we have to follow the recommendations of the authorities. We have to stay and remain locked in for at least 15 days more, or 3 weeks, because we are now having, the most important moment that we can overcome this by just doing the social distancing.
Okay, and I'm gonna ask the question though one more time, doctor. What would your wife do? Would she call? Who would she call? Does she call 911? Does she call Red Cross? Does she call? What would somebody do specifically if they've got if they're in a situation and they've got somebody that's very sick? What do you recommend that they do?
If they have access to a line and call to California, for Americans, they can call to their primary care doctor at the States, or as we said at the beginning, I'll be able to receive phone calls and just try to help them and give them advice on what to do. Or if they cannot do it, they can go here to Mexican local doctors that you can find them, at the pharmacies. They're open. Of course, you have to be very, very cautious about protecting yourself and not spreading the virus when you go and visit them. But yes, make contact with your doctor as quick as possible.
So you would suggest them getting in the car and driving to a doctor's or driving to a local hospital? And if it's beyond that point, then are you suggesting, what if it's an emergency situation? Call 911?
Yeah, emergency situation, yes. Call 911, get an ambulance. Yes.
Okay.
That's what you have to do.
Okay, and in order for people to be prepared to call 911, because some of our people don't speak English, right? When they call 911, are they going to get somebody on the other line that is English speaking? Do we know? Or are they going to have a situation where they're going to have difficulties expressing the challenges of what's going on?
Yeah, it would be difficult. So this question, it would be great to ask it to the mayor, or
to the mayor. Okay.
Yeah, and see if they can put somebody there, and assist them, or at least have the option for people when they call to switch for English, and try to help them. Yeah.
Okay, God forbid people have to use this, but I just want to help them be prepared in case they do. So say they do call 911, the ambulance does come to the house, right? What can they do to be prepared for when those emergency people show up? What is it that they can have that it would be important for them to be able to provide to those to the first responder, the people responding to that call?
They just need to refer their symptoms, and of course they have to wear masks, and that's the most important part. Of course, if they can take a shower before leaving home, great. Of course, new clothing and clean. That's it. Simple as that. But wearing the masks, if you have access to a mask, if not, the paramedics will provide you.
They'll provide the mask. Should they have a list of medication or pre-existing conditions or anything of the people in the home? Should that be maybe translated into Spanish that they could hand somebody a piece, a medica, in case there is a language barrier that they can go, well, here's the medication they're on, or here's what their conditions are. Would that be something people should prepare for just in case?
Yeah, especially now, many more research is coming out now. And they are pointing towards very specific medication lists that those people that are taking those medication are in the higher risk groups. By instance, people taking anti-hypertensive medication like inhibitors from the an enzyme that converts the angiotensin from the kidney. It's a specific, can't remember right now the acronym of those medication, but an example is like enalapril, lisinopril. That kind of family of medication creates a higher risk of people getting sick. Also, people taking ibuprofen, naproxen, diclofenac, ketorolac, Dolac, any kind of non-steroidal anti-inflammatories puts you in a higher risk. So stop taking anti-inflammatories. And of course, also if you have blood sugar, you have to control that as quick as possible. And the best way to control it is dieting. So if you're at home, be aware of your diet, so you make sure your blood sugar levels are, stable. And those are basically, the most important medication that I know that can affect and predispose you to get a worse infection and a worse symptomatic problem. So stop taking all those. If you have the possibility to go to your doctor and switch your blood pressure medicine for something different, like beta blockers or calcium antagonists, some other thing that the doctors can use instead of that, would be great. So call your doctor and see if you can find another hypertension medication. Yeah.
Yeah, and I just want to my goal is to help people be prepared right now. I just want to have them not have to, when the situation comes, or if it comes, and hopefully it doesn't for anybody, but if it does, I want them to already be prepared, because getting prepared in that moment is so hard. And so having that list of medications for that, maybe that each member of the family has or is on, having that ready, maybe already having that converted to Spanish, would be something that they could help give to a provider, or if they ended up in the local hospital or anywhere, they could have that already prepared, right?
Yeah, it would be great to write down in a sheet or somewhere in a notebook or in your phone, what are you taking at the moment, dosages and your regimes, how they are. And you just inform the paramedics and your health providers. Because
I know that was the first question every time my father ended up in the ambulance. That was the first one. What medication is he on? What is it for? So that was the first thing. And I remember sometimes these medications, these names, I didn't have them memorized. And I was like, I don't know. He's on blood pressure. He's on diabetes. I'm going, I don't know. Right now, I got my mind is in a million places because of the situation. And so I learned that I needed to have that stuff prepared prior to those emergencies.
Write it down. Okay. Write it down. Take notes.
Doctor, I want to ask you, is there any testing available for the virus here in Rosarito, or if people think they have it, what is the protocol, or what would they do? I guess, like, where would they go? How much does it cost? And how do they know that they should be the ones going and get tested?
I went yesterday to the biggest laboratory here that is called Certus, and I asked them about the testing, and they said they're getting certified, so they're still not ready. Probably in Tijuana, we'll be able to have private access to these testing kits. But now I know that in Mexicali, we can do it in Mexicali through the institutional health system. And they are very accurate and super fast in Mexicali, but we're still not ready in Tijuana unless they can make it by today. And the costs will be around, in the private facilities, will be around 5,000 to 7,000 pesos. That's like $250, $300, something like that.
That's not cheap, for most people. No, that's a month's salary for some people.
Yeah, that's why I guess Americans can afford it, but for Mexicans, we are really in trouble because it's expensive for Mexicans. Yeah, and so, sure, I'll let you know as soon as I have information where we can do it here in Rosarito. I'll let you know immediately.
And so there's no testing in Tijuana that you're aware of? I thought there was. I thought I heard of some people being tested there.
Yeah, they've been tested by the institutional health system, general hospitals, and some other places. I don't have the right place now, but I can find out and I'll let you know later. Okay.
Right now, before we got on the call, Louis showed me some government page where they're still reporting right now. There's 0 cases in Rosarito. Do you believe that?
I think confirmed cases, yes. But, Kanoa, the virus is among us. And many people curse the disease asymptomatic. So until we have the possibility to test everybody, we will never know. So we have to act as we have here in Rosarito. Yeah. That's
I mean,
that's
I feel that the community has done a really good job. I mean, I've gone out once or twice, and it seems like people are wearing masks. There's very few people on the streets. The mayor has seemed to has told everyone to stay off the beaches and stay out of the parks and stuff. So I don't know, did we get ahead of this in time, or is it like the news is saying that Mexico hasn't been really paying attention to this? Or because for me, it feels like, the numbers are really low here compared to the United States. And it feels like everybody's taking a lot of precautions. Are we ahead of this or not?
I think we have to get tighter and stronger. And I think the Mexican government is still short and behind the situation because, they are asking people to stay at home and just doing essential movements, right? But something that is essential for you might be not essential for me. So you can go and get, a glass of wine, and that would be essential for you, and probably not essential for everybody, right? So the idea is to stay locked in until this thing passes. And I can't see people really doing it here. We're getting better, but I think that we are still like 40% away, to really have a control on people moving around. So that's why we're doing this, because we're urging people to stay at home. And I went to, Mercado del Mar, we all know that place, and it was crowded, a few moments ago. But, people buying essential things and non-essential things. So the idea is to just move if necessary, if it's really necessary. But this is about consciousness of every people. So every decision and action we take as individuals today will affect the rest of the people, not just ourselves. So we have to be very, aware of what we're doing and why are we moving at. So I think we need to stop for the time they say we have to stop. We have to do it.
So right now, because as far as I can tell, I would feel that it's in April, the worst should be starting for us, correct? Is that right? Yeah. So we should be expecting the worst coming right now in the next couple of weeks. Is that correct? Do you believe that?
Especially that's because we're not aware. We don't know how many cases we have. We don't know if last week or a couple weeks travel to California, to Walmart or to, Bonds, you got it there. We don't know. I went to the States yesterday because I went for an essential trip, right? And I went to Walmart and it was crowded too. So, and they're not taking the right precautions. So it would be better to start with us to create the change. Because that's what we're doing this video, to make us, aware of the situation. So we can think and create a plan how to take actions to change this situation, right? So everything starts with us. And let's start here with us.
So, Doctor, I've been doing a lot of, I'm having a lot of time at home right now, so I've been looking at a lot of stuff. And from what I can tell, some of the actions that we can take, the first thing that you're saying is we need to stay at home. So is limit the contact right now. But if we do go out in public, there's certain actions that, we went out and shopped a couple days ago. Man, was that a stressful experience. We're trying to follow all the protocol that we're being told to do of how, to wipe everything down, to wear the masks, to clean the groceries, to not bring in contaminants on our clothes, to do, my God, was that like, it was a very complex, stressful experience. To go out and get some groceries, for the weekend. And my feeling is when we were out in the grocery stores, I'm seeing people that aren't wearing masks, and I'm going, shouldn't we be like changing the culture of like everybody right now out in public should be having a mask on? Isn't that not just to protect themselves, but to protect everybody else? Shouldn't everybody in public have a mask? Obviously washing hands, having a mask on could not only protect themselves, but to protect everybody else.
Yes, the mask is so crucial and important to wear it, because now that there are 3 ways contagious. The first is to have very close contact with somebody by, you know, interchanging fluids. The second one is that like you're in a room and someone sneezes in front of you, or you get, you know, this the virus
aerosol, right?
Droplets, yeah, and get it. But the third way to get contagious is by just talking with, you know, very short distance with people. And we do that very often, you know, at OXXO, 7-Eleven, right, you know, at the pharmacy. So if you wear this, just this, then and blocking your nose, not here. Okay, we need it up here. So then you will prevent to spread and to get through the air these all small, you know, like drops that contains the virus. So this is a must, because Donald Trump is now been accepting that this virus is airborne. You know, I'm as a doctor, I couldn't understand how they say that this virus is not or wasn't airborne, because any kind of flus or respiratory viral infections are airborne, right?
Yeah.
So let's protect ourselves. Yeah, so when we go out.
So shouldn't that be like a requirement? Don't you think? Okay, so right now I was thinking, I mean, the government should be getting involved right now and should be giving masks out to everybody in public and requiring people in public to wear masks. I see the countries that are forcing the people to wear masks in public, and they're doing a lot better than the places that aren't. And so obviously hand washing and masks for people that are in public are not only to protect them, but to protect all of us. And so that's where. Okay.
Yeah, let me tell you how bad the situation is about not having this tool. My brother's girlfriend, she works at an ER in Tijuana. You know, she's receiving the cases there in Tijuana, and the government have provided them just the cheapest, you know, covers they could find, because they didn't prevent it. They ran out of the good, you know, medical grade or surgical grade ones, and now they're suffering, you know, receiving all these viruses. And I thought that this was very, very far from me and my people. And this morning, I my friend, Doctora Veronica, she told me that she was working next to one that got positive. So it's coming more and more and more, and they were wearing, you know, like cheap masks. But at least this will help, okay, to prevent. Try to get something here. Or
but right now, I'm hearing from people that they can't find the masks. Everybody's sold out, you know, and so should people be making homemade masks? Then, if they're going to go out in public, at least to have something to cover their mouth, you know. Once again, it's not always about them, it's to protect other people, right? Because there could be people out there that are carrying it that don't know about it. And how are we ever gonna get ahead of this if we don't stop the spread?
Yeah, if we have the need to go out for essential things, then wear the mask. But why you should take the risk? Stay at home. Stay at home. Simple, right? Yeah.
Okay, Doctor.
I want to tell you something.
Go ahead.
Kanoa, it's about creating new habits, because we have to create habits to clean the car when you use it. New habits when you get back home and you have to drop your shoes and leave them outside to change your clothes. You have to create habits when we go and shop, when we go to the gas station, when we use the ATM, when we, you know, face people or have to talk with people. We have to create habits. Do you know how long it takes the humans to learn a new habit?
30 days.
No, that's too short. It would be great. And you know, and the president is expecting that we can change our behavior in 30 days. Do you think
how long, doctor?
At least 12 weeks to create a new habit. By instance, if you want to lose weight and you commit to go out and work out 4 times a week, it'll take you a while, right, to get there, right? So it's the same with this. the solution, the final solution for this would be a behavioral change from all the people, okay? But it will take a while. That's why if we expect to open our businesses in 10 days or bringing the kids back to school by, the 30th, April 30th, I don't think so. It takes us a while, especially if we are not practicing the new habits. We have to practice the new habits. And if not, it will take us longer.
I completely agree with you, doctor. I think that it's gonna. I find myself when I was out there somebody I saw, I wanted to go hug them and shake them. It's just like it's a reflex. It's a show of respect or of saying. And I had to pull my hand back. It's just it's a lifelong habit of greeting people in a way that I don't think we're going to be able to do for a while.
And there are so many recommendations of these new behaviors or new actions you have to take. So get online and start practicing. Okay, by example, if you're right-handed, you have to use your left mostly, because that way you will not be able to touch your hand, your face, because we normally tend to use the strong hand and touch our face. Okay, so if we use more the other side, then we'll be less likely, to have contact with the virus and on surfaces, and then bring it back to us. So that kind of things requires attention, awareness. That we cannot, let the distractions, the social media, playing a lot, or just not being aware of the situation, that takes us our awareness level down. Because that's the way we're gonna spread this thing out, and then we might probably get contagious. Okay.
Doctor, you just said you just went and shopped, and what was your protocol? Because I got there's a couple questions here, not only for the shopping, but what about for takeout food or for delivery food or any of these things? I mean, everyone's got to eat, so what is the best recommendations when they get something delivered or picked up or go shopping that what are you following?
Yeah, when you're ordering to go, it would be better to have a spray in your car, to spray the bags, to spray the containers, and the same when you receive it at home. So you have to, if you have the opportunity to buy these kind of sanitizers, you can create your own. Do it. Create make a big ones, and then when.
What are you spraying with, doctor? What's your solution?
Huh?
What's your potion?
What
are you using?
My potion. Okay, yeah. Easy. It's alcohol and chlorine. That's it. With some amount of water, but you have to put a lot of chlorine, over 70% alcohol, and just some water to dilute it, because if not, it will be too volatile. I don't know the word, but okay. It will, just so you to put some water there, but use it constantly.
Are you using that on all of the groceries you're buying? So when you went and buy your groceries, are you spraying them all, or how are you bringing them before you bring them in the house? What are you doing with them?
Yeah, when they bring stuff, or I couldn't understand that.
When you went shopping with the groceries, what are you doing with the, how are you bringing it into the house?
Piece by piece, cane by cane, okay, spray them and wash it. Spray them, gloves, mask, spray them until you get this sensation that you clean them all, right? It's about your perception. That, okay, you said, okay, I cleaned it. And yesterday, by example, I have a girl coming and help my wife to clean the house. And the first thing we did when she showed up was to clean the shoes. So we sprayed her all over, and and it sounds like crazy, but we have to do it. Yeah, we have to do it. Yeah.
I mean, it is fun. I mean, doctor, I could see us doing this for a few weeks or even a month, but I mean, how long do you think people are going to be expected to live like this?
We have to create these new habits. I hope to this can make it, or we can make it in a record time, and we'll change our behavior in a record time. But I don't think so. It will take us a little bit longer, especially because if we believe, as I do, in a collective awakening, then I think we can make it in a shorter time than I expect. That I think, but we still need to continue, producing this kind of information and constantly reminding people gently that they should become aware of the situation. They have to become aware of their thoughts and their actions, of course, and just practice. How are you going to become aware? The news, meditation, workout at home. Don't lose your time on banal things. Cultivate your cleanliness, your discipline towards food, and you have to fix, and we have the opportunity to fix our lifestyle. So this is actually a huge opportunity to improve in many ways, in many areas, many fields in our lives, and not just for ourselves. We can help our families, and we can help the community, because we're still here in the world, right? And we have to protect ourselves and the rest of the people. So I think I would like to talk about more. I have a few other things that I would like to talk about.
Doctor. Go ahead.
Yeah. So I read a few of your questions that asking about the risk groups. I just want to tell you that we all are risk groups. Of course, many people can die if they have pre-existing conditions and if they're taking some medication, and if they are not aware, right? If they lose their attention. So remember, all these infections are opportunistic diseases. Opportunistic diseases that takes advantage of our weaknesses. So if we get stronger, then we'll be able to boost our immune system. And I've been telling you about boosting our immune system since I met you.
Yes.
For more than 3 years, 4 years. Boost the immune system, boost the immune system. And now it's become a priority. And when you buy vitamins and supplements, they claim, oh, this is to boost your immune system. This is to boost your immune system. But now that's exactly what we need. We need to boost our body response. So I've been, the last days, I've been trying to find a way to help the American community by bringing products from the states, from California, that now the FDA had released to boost the immune system. So I'm working on it as quick as possible, as fast as possible. So I'll post, I guess, tomorrow, a couple products that they can get here, they can buy here, and to boost our immune response. And I think this should be one of the most important approaches to work on boosting our immune response.
And wearing a mask.
Yeah, wear the masks.
Yeah. I will make sure.
Here.
Yeah, I'll be careful. I would, as soon as you are ready, doctor, you tell me and I'll help you I'll make sure all your information is out there for anybody that is interested in or wants to talk to you more about that. We'll make sure we can connect you with them. Okay.
And last thing.
Yeah.
For Americans, don't go to California. Follow the recommendations from Donald Trump and from the governor there. Stay at home. Don't go there. I went, as I said yesterday, to the States, and the line was so long, like on a regular, basis, right? And mostly American people getting across, back and forth. So stay at home. And enjoy your house, paint your house, do arts, play music, read. We are always asking for time, right? I have no time to read. I have no time for this. We never have time, but time is now our most important asset. So let's use it wisely and try to get better. So that's my final recommendation for today.
Doctor, I really want to thank you. I really appreciate it. I hope, that we can help some people out there in our community, that we can bring them this information. I want to let everybody know also, we're going to put a link in the website in rosaritoliving.com to an emergency preparedness sheet where we'll give you the best advice we can in case of an emergency with contact information and instructions. And we just hope that everybody stays safe and sorry. Please subscribe to the channel for updates, and we will be doing our best to get you the updates as soon as we can and get them out there. And everyone else, I'd like to tell everyone, stay positive, stay healthy, and stay home. All right. Bye-bye, everybody.
Gracias. Gracias.